Hi, my name is Dr. Ajay Bakshi. I'm the Managing Director and CEO for Manipal Hospitals. On a lighter note, the weather in Bangalore is much better than in Delhi. But on a more serious note, Manipal is a 60-year-old organization. I think I find the fact that it has been an educational institution very interesting and very relevant to healthcare. Manipal University, as you know, is one of the first private, it is the first private medical college in the country. And we from the Manipal hospital side take care of those hospitals as well as a contract. So the brand Manipal stands for great values, longevity, the best possible clinical care, and that's something I feel very privileged to be working with. So we're clearly on a growth path. As you know, we have two private equity investors with us already, India Value Fund Advisors and TPG. And we are looking at both brownfield as well as greenfield growth. Right now, we have 4 hospitals under construction, which will go live within the next 3 to 12 months. There's one in Malaysia, there's one in Mangalore, there's one in Whitefield in Bangalore, and then there's another one in Delhi. So these will add another 1,000 beds to us over the next 12 months or so. In addition to that, we are also looking at brownfield acquisitions, and as and when they happen, we will of course come back and inform you about those. Yes, that's something that is on the roadmap. It's too early right now to say whether what is the time window and what is the structure with which we go to the IPO, but clearly with private equity investors, that is one way of giving them a favorable exit. Yeah, that's a great question. We believe that 3 or 4 things are changing in the healthcare landscape of India, which is influencing us to invest more in oncology. First of all, there is an epidemic of oncology in India, epidemic of cancer. There's a huge upsurge of cancer patients that are diagnosed. Some of this is because earlier there was underreporting and underdiagnosis. People were just too scared and they won't come forward for their test. That has changed now, fortunately, and people are coming earlier for their test. I think the second related is our lifestyle, our exposure to chemicals is also contributing towards an increase in cancer. Secondly, oncology is very complex. It requires multiple doctors to work together. A related point is massive increase in knowledge in cancer is happening because of large amounts of investments that have gone in over the last 2 decades. And this is making cancer care a very central part of a modern hospital. That's why we are investing so heavily in this space, because we feel this is a huge need of the hour for the country, and it's going to remain an important need over the next decade or more till we control it. And therefore, we are investing in cancer in a big way. I think that's also a very important point. Across the globe, you will notice wherever preventive oncology has succeeded, most of it has come from public health infrastructure. Large-scale breast cancer screenings, large-scale pap smears for cervical cancer. In Japan, you will be surprised to know, earlier there used to be a lot of stomach cancer, but the government of Japan ensured that even invasive tests like upper GI endoscopy happens and they controlled cancer. So you're absolutely right that prevention is truly the answer. But prevention is something that most people are not willing to pay for. And that's part of the mindset that we have to work together with the government to change, that either tests are available for subsidized or free prices at public health facilities like community hospitals or district hospitals. And to the government's credit, they are doing that. So pap smear is available now in most of the district hospitals as well. But there is a possibility of a partnership between government and private health sector, where the government focuses on increasing the awareness. And the private health sector focuses on delivering those tests and making sure that once a test comes positive, the patient gets it treated. Otherwise, just doing a test and finding a cancer and not doing anything about it is not going to be very helpful. So you're very right in pointing out that prevention is very important, and that we are working closely with governments in many states to make this prevention a main theme for their approach to the community. PPP is too narrow. I think I'm thinking PPP is a very structured vehicle for a particular project. I'm talking about a larger collaboration between, say, a state government ministry and the private sector. I'll give you an example. You talked about Max. When I was at Max, we worked very closely with the state government of Punjab, where we had 2 hospitals, to launch a statewide screening program. And the government of Punjab was constrained in that they did not have enough doctors. But from Max, we were able to give those doctors. So similarly, in Manipal, we are working closely with the government of Rajasthan, with the government of Karnataka, to promote screening, because that is the best way to control cancer. No, so we are short of doctors, of technicians, of testing capabilities. But look, it's a journey. It's not going to happen with pressing one button. As long as both government and private sector are talking about it and working on it, I'm sure we'll start that journey. We have started, but it's a long journey, and as a responsible citizen of this country, each one of us must contribute to it by at least getting ourselves and our family tested. Yeah. So IBM and Manipal have partnered to bring what is called cognitive computing for oncology to India for the first time. This is a very powerful partnership for a simple reason. The way computers work and computing happens has fundamentally changed over the last 3-4 years. For the last 5 decades, computers were programmable devices. What you tell them is what they will do. If you have bad programming, then they will have bad outcomes. But it has contributed a lot to the global economy over the last 5 decades. Now we have reached a stage where computers are able to learn just the way the human beings are able to learn, just the way a young 18-year-old student in MBBS can be taught over 5 years how to become a doctor. Computers can now be taught how to read and understand medical literature, and then throw out knowledgeable insights that doctors can use. So IBM Watson is a tool for oncology right now. It basically takes care of cancer patients, where it will work as an assistant to our oncologists, our cancer specialist, who can then make sure that the millions of papers that are published in oncology, all the knowledge that is embedded in them is brought to the patients.
And are our clinical oncologists will be able to make use of this?
Oh sure, they are very excited, and they are all delighted that this new technology is coming in, because each and every doctor in India is struggling with the expanding mass of knowledge that is available. Just to give you one data point, 130 new papers get published on cancer every day. 130 new papers are published every day. There is no way a human being can read that much and absorb that much knowledge. So with Watson, it will read that, it will absorb that, and when I am seeing a patient with brain cancer, for example, I am a neurosurgeon, Watson will tell me that this is the latest research in brain cancer which is applicable to that patient. So that's why I think of Watson as a humble genius who is an assistant to all our doctors, who will be working 24/7 to learn and then bring that knowledge to a doctor so he can deliver that knowledge to the patient.
So this is more like the research based, helping the doctors.
Yes, it's not a research protocol. It's a real commercial tool. What it is doing is bringing the findings of research to the patients.
Right.
That is what it is doing. Normally, that can take 5 to 7 years because there is so much research happening. But with Watson, we can do that within a few days or months. Look, with so much of new technologies coming in, the overall cost of care is increasing. PET CT, when I was a neurosurgeon trained, MRI was not there. We used to manage patients with CT scan only. But when MRI came in, it's certainly more expensive, but it also improves the quality of outcomes. So there is always a trade-off between cost and quality. So the way to think about it is you can make that trade-off very knowledgeably now. You can reduce the cost by accepting a slightly older treatment, but with a clear understanding of what the outcomes will be. So that's how Watson will help our doctors make those decisions very transparently with the family. Well, look, progress is a difficult journey. We are fighting some negative forces, by which I mean negative forces of increased exposure to chemicals, poor lifestyles. Those are the things which are causing more cancer. Yeah. At the same time, there's a lot of clinical research, there's medical progress, there are new technologies. So obviously, as human beings, we adapt and we have increased our lifespan over the last 200 years almost 3 times. So we predict that we are going to continue to improve, but it's going to take a lot of effort. It's going to take a lot of effort from patients, from doctors, from technology companies like IBM. And as a healthcare person who's been in this field for almost 25 years, what I feel excited about is that non-healthcare company like IBM, you wouldn't have thought of IBM as a healthcare company. Google, Microsoft, Cisco, all of these companies are investing in healthcare because they feel that their technology can help us doctors. And that's a great sign, because then all the world's intelligence is combining to solve some of the most complex healthcare problems. That's a very nice future to look forward to.